So right now we've taken off, we've done 2 passes with a stronger setting around the scar, and then in the periphery around the deeper portion that we've done 2 passes, we've done lighter passing twice around it to blend it in. And right now we're going to take this sterilized sandpaper made out of silicon carbide, and we're going to go over this scar to get some pinpoint bleeding and try to make that scar totally disappear. And right now I'm just getting sandpaper ready, and I'm just going to go over it. Sometimes it helps to put a little gauze in there to make that more solid. Right now I'm just trying to buff away the scars. And now you're starting to see a little bit more pinpoint bleeding there. And with dermasanding, this is called dermasanding. It's a technique of dermabrasion. It allows me to more accurately get to the right plane. Currently, I'm just trying to see whether there's pinpoint bleeding. I'm getting that. And over here, I might do just a little bit more. And that's going to more effectively disguise that scar she had there. I think that's probably good there. Now we're going to go on to the larger scar that she has up here. It's almost hard to see now, but we're just going to do the same thing here. So we get some pinpoint bleeding. Readjusting this sandpaper to get the right part of the sandpaper to get it just correct. And I think we're getting pinpoint bleeding there. That would be indicative of the right layer. And then I'm going to go over here a little bit more to get this part of the scar here. And just gently clearing it. I'm going to get some more sandpaper. And going over this part again, notice how this has reached a good depth of pinpoint bleeding, but it hasn't done so in this area, so I'm going to go a little bit, a few more passes here. And the benefit of doing dermasanding as opposed to dermabrasion is you don't use that wire brush which can be very aggressive. This approach allows you to more carefully control the plane, and it avoids tissue being sprayed around with the dermabrasion. The dermasanding is controlled, and you don't need that. And notice how we're getting into pinpoint bleeding. That's going to be the area that we're going to stop. Now, bigger bleeding points means that you're going deeper. And right now we have some pretty tiny bleeding points, so I think that's going to be good for her. I think over here we might need to do just a little bit more here. And I think right now we're getting it to a good point here. And it's always better to be conservative than more aggressive. And allow the tissue to do some of the healing. So I think I'm going to elect to stop now and not be too aggressive, because I think we've gotten into a good plane there. Can always be repeated again if we need to, but it's better to be conservative and safer and avoid complications in any way as much as possible. So right now I'm putting a very thin layer of Vaseline over this, and what we do is tell people we have some instructions that people follow. And essentially you don't want crusting to accumulate in the area that you're resurfacing. That can be the whole face, but you don't want crusting to accumulate, because that can lead to bacterial infection and scarring. So you always want to wash this area really well, and sometimes every 2 to 3 hours, or even every hour, until the crusting is essentially taken away, and there's really a raw surface area and a thin coat of Vaseline over it to allow it to heal. So that pretty much is the conclusion of our resurfacing and dermasanding, and thank you for watching.